Welcome to Health Bulletin. On February 13th, the World Health Organization provided additional information regarding a report from China about a woman who passed away last year due to a co-infection. As per the report, she was simultaneously infected with both the H10N2 seasonal flu and the H10N5 avian flu. The case marked the first known human illness involving H10N5. As per the report, the woman in her 60s worked as a farmer in Anhui province and had underlying health conditions. Her respiratory illness symptoms began on 30th Nov, and she was hospitalized on Sudek. When her condition worsened, she was transferred to a facility in Zhejiang province on 7 Dec. On December 16th, she succumbed to infection. Before we move forward, if you're finding this content helpful and informative, please consider hitting the subscribe button below for the latest in medical breakthroughs and health alerts. Earlier this year, on January 22nd, authorities in Zhejiang successfully isolated H3N2 and H10N5 from her respiratory samples, which were confirmed on 26 January by the Chinese Center for Disease Control and Prevention. Investigators found that the woman had not been vaccinated against seasonal flu. A few days before her symptoms began, she was exposed to live poultry when she bought a duck. Lab testing on duck meat from the woman's refrigerator found H10N5 in 7 samples. There is no evidence indicating that the woman had contact with pigs or any other mammals. Although environmental samples from her home were negative, monitoring of the woman's contacts in both provinces found no related cases. Agriculture authorities conducted a traceback investigation of the ducks and of culled birds and disinfected affected areas. According to the WHO, the H10 strains are occasionally detected in wild birds, also poultry, and mammals in different parts of the world. They are low pathogenic viruses that don't require reporting, and that's why their prevalence remains unknown. In 2008, avian influenza H10N5 was isolated from swine in Hubei, China, and researchers emphasized the need for further research to understand its epidemiology of H10N5 among animal populations. So far, avian H10 viruses haven't acquired the ability to spread from person to person. Influenza viruses are impossible to eradicate, and zoonotic infections will continue to occur. So to minimize public health risk, quality surveillance in both animal and human populations, thorough investigation of every human infection, and risk-based pandemic planning are essential. Public health and animal health authorities should work together and share information during investigations of human cases of zoonotic influenza. Meanwhile, it's crucial for travelers to countries with known outbreaks of avian influenza, as well as residents of affected regions, to take precautions. If possible, avoid visiting poultry farms, live poultry markets, or areas where poultry is being slaughtered. Additionally, steer clear of surfaces that may be contaminated with animal feces. Anyone returning from affected regions should promptly report to local health services if they experience respiratory symptoms suggestive of zoonotic influenza virus infection. Despite its classification as a low pathogenic virus, the detection of H10N5 in ducks and a human serves as a reminder of the need for further research in this area. Thanks for watching, and if you enjoyed this video, make sure to subscribe to our channel for the latest in medical breakthroughs and health alerts.